Viruses and the risk of lung cancer, prevention and treatment. Dr. Joseph Arturo Pinto Blitas. Course, Medical Rounds. Student, RUPIRE Chaves Brandom Lee. Group 2. Contents. Number 1. Introduction. Number 2. Lung cancer in Europe. Number 3. Viruses and their relationship with lung cancer. Number 4. Prevention and treatment of oncogenic viruses. Number 5. COVID COVID-19 and lung cancer. Number 6. Conclusion. And number 7. References. Introduction. Tobacco smoking is the main risk factor for lung cancer. Other risk factors include exposure to asbestos, household use of biomass fuel, environmental pollution, genetic factors, and chronic diseases. For example, asthma, bronchiectasis, discussed in other chapters in this monograph. Infectious risk factors such as mycobacterial infections, previous pneumonia, and chlamydophilia have also been reported and investigated. Recent reports suggest that viruses such as HPV, Epstein-Barr virus, EBV, and measles virus, MV, may play a role in relation to lung cancer. However, the association between viruses and lung cancer has not been uh, thoroughly elucidated. Lung cancer in Europe. In 2020, a total of 318,327 new cases of lung cancer were estimated to be diagnosed in the 27 countries of the European Union. Overall, 64% of cases were diagnosed in men and 36% in women. People aged since 45 to 69 years had the most reported new cases, followed by people aged over 20. Over 70 years, and people aged 20 and 44 years. Viruses and their relationship with lung cancer. Although the molecular perturbation caused by some infection agents leading the oncogenesis are well known in several tumor models, including cervical cancer, stomach cancer, head and neck tumors, and some types of leukemia, and lymphomas. The pathogenic role of viruses has not yet been well established in lung cancer. However, evidence of the integration of viral DNA in tumors cells and epidemiological research based on clinical studies and several meta-analyses suggest a possible causative role for infection agents in lung malignancies. Prevention and treatment of oncogenic viruses. Prevention of infection by oncogenic viruses is complicated as expected for HPV. There are no approved vaccines for the viral agents described in the previous section. However, there are no data supporting a decrease in the incidence or risk of lung cancer in the population vaccinated for HPV. After viral infection has been detected, there are some strategies to avoid viral activation to block or diminish oncogenic transformation. In EVV infection, smoking, cessation should be recommended for smokers as the primary prevention measure for upper respiratory tract carcinomas. COVID 19 and lung cancer, the future challenge of research. The COVID 19 pandemic has had a major impact on global health. Despite all this research carried out in record time, much remains to be determined, especially regarding the complication and possible long-term sequelae of severe SARS-CoV-2 infection. The possible damage by the virus to the lung causing lung fibrosis, the hyperinflammation, frequently suffered by patients with severe COVID-19, and downregulation of angiotensin converting enzyme to ACE2 could be involved in the potential development of lung cancer. In conclusion, the role of viruses in lung cancer development remains unclear but is supported by epidemiological data on infection in tumor cells, although basic research studies have shown potential oncogenic mechanisms of viruses in lung cancer cells lines. Further research is needed. Tobacco smoking can contribute to viral oncogenesis by producing local immunosuppression and increasing viral pathogenesis.
Reference. Thank you.